This is Porn Talk.
Welcome back to Porn Talk. This is Powerful Eric. We are here back with Dr. Ann Truong. She has treated over 7,000. Is that right? Oh, it's on your website. 7,000 men with ED issues. Holy cow. So if you haven't listened to the prior episode with Dr. Ann Truong, please go back and listen to that one. So we're going to get into some solutions. But before we do that, can you tell us just real quick in a nutshell, how did you, this is a very unique niche in the medical field. How did you get into this?
That's a great question. In fact, my specialty is actually, I'm a pain management doctor. That's what I've been trained on. But ever since I started doing pain management, this is how old I am. When I finished medical school, I was in 1993. And at that time, pain was the fifth vital sign, right? So they were pushing, okay, doctor give pain medicine for patient with pain. So I was giving them opioids and I was injecting cortisone or steroids into patient joints and back for their pain. But then that's what I was trained, right? And then after a few years, I was like, I am not helping my patient anything. I'm not helping them at all. I need to find out a solution that will give them long-term relief and treat the cause of the problem. So I learned about acupuncture and I learned about the power of stem cell that you have in your body. So instead of injecting them with a steroid or giving them medication, I started treating my pain patient with their own stem cell and with acupuncture. But that led me to, I was treating a patient on his knee, and he said, you know what, you do a fantastic job with my knee. I also have ED too. Do you think this will help with my ED? And I treated him with his own blood. Which is, it has platelets in there, which can heal tissue and can restore blood flow. And I said, you know what? And you are absolutely right. If I can inject your own stem cells in your spine, in your knee, in your hip, in your shoulder, I can certainly do that to the penis. And luckily, I was a pain management doctor, so I'm able to numb up the area, so it's not a painful injection. Because when people say, "Oh my God, you're injecting the penis," that must be painful, and you'll be surprised. It's not painful at all. It's kind of like getting your teeth pulled by the dentist. They numb up your mouth, and you don't feel anything. So, well,
visual is killing me.
I know, but it's let it not deter what the purpose of that is treating the cause of the problem. So my passion has always been trying to find out the root cause of the problem. But what I find is that so when I treated my patient with ED, when I was treating his knee with his own blood or his stem cell, that's when it became to me that this is really something that I can really make a big impact on, because it's a lot of taboos, there's a lot of myth, there's a lot of mystery behind sexual health, especially for men as well. And it became my passion that this is where I really want to focus on as well, in helping men become powerful again in their own sexual health and be able to lead them in the right direction in helping them avoid pitfalls and gimmicks and sales tactic towards simple solution that actually will be effective for them.
So what are some of those solutions?
Oh my goodness, you'll be surprised if I mention some of them. You're like, oh my God, it's like there's a saying that you don't know what you don't know, right? What I am gonna let your listener know that if you want to continue to have a good sexual vitality, or if you have ED, these are the things you need to be doing to start looking at it and finding a solution for it. Number one, if you're smoking, you gotta stop. Because if you're smoking, you might as well just tie a rope around your penis and tie it off. Because you're smoking, that's what it does.
Dr. Ann has a lot of really powerful visuals. They're painful.
Yes, because that's what smoking does. Smoking literally just hang up your erection because smoking decreases blood supply to the organ, all organ, not just the penis, all organs.
Constricts blood vessels.
Yes, it constricts. So it narrows the blood vessel. You're not getting blood when you're smoking. The nicotine make your blood vessel smaller, so you're not getting blood. You're not getting blood to your throat. You're not getting blood to your kidney. You're not getting blood to your liver. You're not getting blood to your skin. That's why when you notice smokers, they have a very deep voice because their vocal cords it's not getting the blood, so the vocal cords kind of slowly dying. So stop smoking is the number one thing. I know that's hard because I treat my patient and they smoke too. It's very hard for them, but you got to do that. Number one is evaluate how much alcohol you're drinking. All right. Because the number one contributor to ED is alcohol. And so alcohol, when you take a little bit, can actually help you with your erection because it helps you relax. So as I mentioned before, is that when you're relaxed, you can have a better erection. But too much alcohol, what it does is that it makes the nerve doesn't work well. The blood vessel just doesn't open up as well. So, but too much alcohol is inflammation as well. So that contribute to ED. And then another factor is what's your weight? Your BMI should be under 30. And you calculate that BMI, and you can go on the web and just find how to calculate your BMI, put your height and your weight in. It should be under 30 because when a man is over 30 of BMI, why is your weight so important? Because when you are overweight, you tend to have high blood pressure or high cholesterol, and those conditions can lead to decreased blood flow. So check your weight and then look at your sleep. How many hours are you sleeping? You should be sleeping at least 7 hours a day, between 6 to 7 hours a day, and really sleep between 10 p.m. to 6 a.m. because that's when your body heal physically and heal mentally as well. So there's simple things like that. And then look at your diet. What diet are you eating? Are you eating a red meat potato, French fries, a donut in the morning, and then hamburgers and fries in the afternoon, and a steak at night?
Dr. Truong, I had watched this documentary, and I wish I could think of the name of it. Arnold Schwarzenegger is in it very briefly. Believe it or not, Arnold Schwarzenegger, Big Arnold, is now an advocate of a plant-based diet, not exclusively, but they did a study on the show, or not a study, they showed they had these athletes, high performance professional athletes. They had one eat meat, they had one eat a vegetarian meal, they had one that was a mix. And then soon after they had their meal, they drew their blood. And they put it in the thing that spins to separate the blood from the plasma, and then showed it to each athlete. And they said, "This is your blood now." And it was so clear. The plant-based one, the guy that ate just vegetarian, it moved really smooth. It was clear. And the one that ate all the meat, it was really foggy and it moved kind of slowly. So I can imagine what you're saying right now. Like if you have ED and you're eating a bunch, like we said in the last podcast, a hamburger, that's making that slow blood, right?
Right, sluggish blood. Slow, sluggish. Yep, slow, sluggish blood because the blood becomes more dense because it has more fat. And when the blood has more fat in it, it becomes more dense. So it's why it becomes sluggish. So you can actually see that, on an ultrasound. You can actually see that it's just not smooth flowing, fast, smooth flowing. It's become sluggish. And then when it becomes sluggish, well, what do you think happened when you have an erection? When you have an erection, blood has to gush into the penis in order for it to enlarge. And when the penis enlarges 40 to 50 times is flaccid or non-erect size to be erect. 40 to 50 times. That's how the blood vessel have to dilate, to open up and to spread to
Dr.
get an
Ian,
erection.
I looked up the documentary. It's called The Game Changers. It's on Netflix. It's outstanding. I highly recommend it. You can see that where they show the blood from each person that ate the different meals. It's very clear. The Game Changers on Netflix.
Well, I'm going to check it out.
Yeah.
I'm glad you showed it to me. I'm going to
Yes.
check it out and probably talk about it in my next podcast itself too. I have a podcast called Sexual Health for Men, where I educate men on sexual vitality. But I'm definitely going to check it out. Thank you for that.
Yes, and you can see Arnold. You can see Arnold on there, and he. Who would have thought that big Arnold Schwarzenegger is pretty much, at least what he says on the documentary, that he's really pretty much sounds like vegetarian, which just blows my mind. Like, really? Like Arnold Schwarzenegger? Wow.
Yeah, well, that's not so much vegetarian, but just an anti-inflammatory diet. And I advocate the Mediterranean diet, which is it allows you to have some bread too. It's just less red meat, and more vegetables and more lean meat. What's lean meat? Fish, chicken, without the skin, and less red meat, less eggs, but a lot of vegetables. You can even have a glass of red wine a night, but a lot of fruits and vegetables. A vegan or vegetarian diet is very restrictive. I definitely think you need to have some proteins in there, but a Mediterranean diet is very doable. And that's what I advocate when I work with my patient. I even give them access to an app that will help them with a structure, activity, a structure outline of what they need to eat every day, how much they need to drink, how much they need to exercise every day to really detoxify and restore their blood flow again. And how do you do that? Like I talked in your last episode that the penis is the largest organ of blood vessel, and it's very sensitive to what you eat.
Yeah.
So whatever you eat, it's gonna flow. It's gonna flow in your blood vessel to your penis. So you have to be very conscientious of what you're feeding yourself, because if you're gonna eat that donut's gonna go to your penis a lot more than it goes to your to your liver.
Oh my God, these visuals are great. My donut is going to my penis now.
That's right.
Yeah, backing up a little bit, just to be fair to Arnold, he did not say he was vegetarian, but he's definitely, not the big meat eater that he used to be. But, one thing that has done really wonders for me is fasting. I'm a big advocate of fasting. I started with intermittent fasting, and then I went to full fast, even long-term fast, and they do wonders for me. I had rosacea forever, and I took all the pills, did all the creams, all this stuff. Nothing seemed to work. And then I started fasting, and it pretty much went away.
Yeah, well, when you fast, your body start cleaning up your dead cells. So it's that process called apoptotic. So that's why your rosacea went away, because it started cleaning up the cells in your body that were not functioning well, and it was contributing to inflammation. So you are decreasing inflammation when you fast. And I advocate, 16-8 is that, fast for 16 hours every day, and eat in that 8-hour window, and stop eating after 7 p.m. And eat in the window between 12 and 8, which is a large window. So and make your lunch your biggest meal, and your dinner should be a smaller meal than lunch. But like you said, I totally believe in intermittent fasting, and it has a lot of health benefit, but it's also benefit for weight loss and decreased inflammation as well. So my point about, getting back to my point about, reversing your, and, what to do when you have ED is just to look at, diet, and what you're eating, your sleep, stop smoking, minimize alcohol, but also exercise. What kind of exercise? High interval intensity exercise, HIIT
Yes.
exercise. Yes. HIIT exercise, even just 30 minutes, even just 30 minutes, 3 to 4 times a week is all you need to do. That's form of exercise. Now you can spare 30 minutes a week. I mean, 30 minutes, 3 to 4 times a week, which is really about, 2.5 to 3 hours of your life in a week to exercise for your health. I mean, that beats sitting on a couch watching Netflix, or, even 30 minutes just looking at your phone,
Yeah.
on
Exactly.
social media.
Exactly.
Right.
That's
Yes.
a very good point. Take that 30 minutes or probably hours that you're staring at your phone playing Candy Crush or whatever, and convert it to a little exercise, some HIIT exercise, high intense
Yes.
exercise.
Yep. High intensity exercise, because that exercise works because it builds muscle, and muscle, guess what? Muscle make more testosterone. When you have more muscle, you make more testosterone. And testosterone is the male hormone that make you a male, but also as a hormone that will help with erection as well too. So more muscle, more testosterone, better sexual performance. It all kind of goes together. That picture, but just those things that you can do about, evaluate what you're doing. Did you check off what I just said? Now, did you do all that, and take a look at your medication? Number one thing is your medication. Are you taking a high blood pressure medicine? Are you taking high cholesterol medicine? Well, if you are, and you say, well, I have to take this. No, you don't. Studies have shown if you just lose 10% of your body weight. So for a 200-pound man, you lose 10% of your body weight, which is 20 pounds. You can get off of your blood pressure medicine, get off of your diabetes medicine, get off of your cholesterol medicine. Now, only 10%. You don't have to lose 50 pounds, just 20 pounds, and you can get off of all those medicines. Because some of my patients think that they're bound and they're powerless and they have to depend on this medication. No, you don't. You're not born. Your body is not born dependent upon these medications. These medications are synthetic. They're synthetic. They're made in the lab. So you're taking this medication because you're not taking care of your body. But if you lose the weight, then you can actually get off of the medication, because, like I mentioned before, we're not born needing this medication. Your body does not need medication for it to function. All right. So so I want to dispel the myth that you can't get off of the medication. You can, by just doing the simple lifestyle factor that I mentioned before.
Dr. Truong, I have successfully helped a lot of guys that have porn-induced erectile dysfunction that did not have any like physical problems. However, recently I've got a new client that he actually stopped. Most of the guys that come to me are still active in their addiction to porn, and they want to stop because they've got ED. However, this one client had already stopped the pornography for 2 years, and had contacted me. And what's the longest that you've heard that somebody's had a pretty severe case of ED? Like what's the range? How long? What experience have you had? What's the longest?
Right. I think what your question you're saying is that I would tell you I have treated a 80-year-old man who's had 20 years history of ED.
Ooh.
20 years history of ED. He's 80, and we're able to restore his erection again. So to answer that question, so if you have problems that last for years, you definitely can restore it. Now, and one the caveat is that this 80-year-old is he lost actually 50 pounds. He lost 50 pounds because he wanted to get, he was moving, not as moving as well. He didn't like the way he was moving. He lost 50 pounds. And then with the treatment that I give him, he's able to perform and perform again. In fact, he has a 79-year-old girlfriend now, and they're having sex 3 to 5 times a week after 20 years of not able to function. So
you said three to 5 times a week. Is that what you said?
Yes.
I need to I need to talk to him.
Well, his testimony is on my website as well, and he feels that at 80 he's living his best sex life. And what he's also noticed too was that with our treatment, he's also noticed that his penis also got a little longer and larger, not because it was more growth, it's just that it's becoming more firm, it's filled more with better blood flow, so that what he feels that is larger and longer. But the point I'm trying to make is even at 80, in 20 years without getting an erection, it can still be restored. But the caveat with that is that he did lose some weight as well to kind of push it along. But if you're not going to have your erection restored if you continue to smoke, if you don't exercise, don't change your diet, and sleep 3 hours a night, and if you're not doing the lifestyle factor changes, then your body's not going to start healing.
I can't help but think you were talking about the 80-year-old and the longer and all that. When I was a kid, one of my favorite television shows was the $6 Million Man, the Bionic Man. And they would say in the intro of the show, we can rebuild him better, stronger, faster. And when you were talking about that, I couldn't help but think of that, but I was changing it in my mind. Better, longer, faster.
Oh, that is very good. Better. I'm gonna write that down. Better, longer, and faster, right? The $6 Million Man, right?
Yeah. Exactly. Dr. Ann, so if somebody is listening now and they think they may have, you said ED is a spectrum, and that was enlightening for me because typically I just get the one segment that's the porn-induced erectile dysfunction. That's generally the ones that come to me don't have a physical problem. So, but if somebody, they're on the spectrum they're unsure, would somebody reach out to you and or what could you do for them?
Right. So even for your listener, porn-induced ED, I want to stress the point that, remember, we talked about the 6 systems, all right? And so they got to work on, getting the 6 system working in synchrony again with the brain, the emotion, the hormone, the nerve, the blood vessels, and the muscles again to restore their erection. And like I said, the brain is a larger sexual organ. So that's what my approach to restoring sexual function again is, to restore those 6 systems. So my approach is the multimodality approach involving the 6 systems that I had mentioned. So the way to get the best way to connect with me is to go on my website at www.truongrehab.com, TRUONGREHAB.com. Or the best way also is to follow me on my podcast, The Sexual Health for Men podcast, on all the podcast platform, or at Instagram at Dr. Anne, DRANNE_official. Spell the word official. That's the best way to get a hold of me. And for them to get, I also have a free book that talk about 5 common mistakes that men make when facing ED. If they go on my website at truongrehab.com, they can get that book. And it talked about essentially what I talk about in this episode in more detail as well, too. And the number one thing I want them to know is stop taking that blue pill and don't use that online dispensary because you're going to end up in a black hole a few years down the road because you're not helping your condition any.
Right. And so get Dr. Ann Truong's free book, The 5 Common Myths.
No, the 5 common mistakes men make when facing ED.
Awesome. Well, I appreciate that for our listeners. And before we close, any final words of wisdom?
Yes. My final word of wisdom is that your listeners know that you can have sexual vitality for life, and that you do not have to have decline in sexual performance as you get older. It can be done. I have seen it done. And it takes simple things such as lifestyle changes. So what you're eating, are you exercising and sleeping, and looking at your daily habit, what you can do will go a long way. Because I have seen it in my 80-year-old patient. I've seen it in my 70-year-old patient that they're having sex 5 times a week. So it's not a myth. If I have a man who's an 80-year-old that can have sex 5 times a week, it is not a myth. It can be achieved, and know that you can enjoy sex for a lifetime, and that you should not take a decline in your sexual performance as a part of aging, but introspectively look at what's going on and what you can do to improve that.
5 times a week. I got to go on your website and watch his story. I'm a little jealous. 5 times a week.
Yeah. Yes. You know what? When my husband and I, that is our goal. I said, if my patient Ed can do it, we can do it. And that is our goal. And if we go below 5 times a week, then, we're not at par. And in fact, I didn't mention this, but the more sex you have, it actually improves your ED. So meaning if you don't use it, you lose it. So remember, the penis is a muscle. So if you don't use it, you lose it. So it's like your muscles in your arms and your leg. You don't go to the gym enough, you're going to have muscle atrophy. The muscles are not as bulky as it used to be, right? So if you use it more, then it becomes a healthier organ. It gets used to functioning. So you can't expect a man who has ED for like a year and then be able to perform again. It's like almost not going to the gym and then expect to bench press, 200 pounds and do it, because you got to work up slowly. So that is the thing. Use it or lose it. It's another thing that your listener can benefit from, is use it or you lose it. And if you lose it, restore it and start using it. And it doesn't have to be with a partner. Your body senses, it doesn't, as long as you get the blood flow going, whether through, solo or with a partner, you just get it going, get the blood flow going. So it's either through masturbation or solo or with a partner. It's the same thing. Get the blood flow to go down to the penis, get an erection, and get clear the pipes and get it moving.
Well, Dr. Ann Truong, it's been an absolute pleasure to have you on the show. You are a wealth of information. Go to her website, download her free book, and I will close with a quote. You are designed for accomplishment. You are engineered for success, and you are endowed with the seeds of greatness.
Join Powerful Eric's free Facebook group, Endeavor to Quit, and take control of your life. Learn more at powerfuleric.com.